Hello, my name is Dr. Xiong. I'm an internal medicine physician from Dallas, Texas. Today, I want to talk about shocking patients. So I remember when I was watching a lot of medical shows or TV series, in a lot of scenarios, when the patient become unconscious, a bunch of medical doctors and medical professionals just rush into the room and start shocking people. So in real life, do we really do that? Not really. So I want to talk about when do we shock patients, when do we not. So in those kind of real emergency situations, it really doesn't really allow us to think too much. So we really follow a predetermined algorithm to guide us about what to do. This algorithm is called ACLS, or the full name is called Advanced Cardiac Life Support. It is a booklet that can be found on the internet. It's all free. It's from American Heart Association. All of the healthcare professional has to go through this training to make sure we understand the algorithm and to know what to do during those kind of emergency situations. I think a lot of people have heard the word CPR, or cardiopulmonary support. So CPR is a basic version of life support when you do not have all the advanced equipment. But when you're in a hospital setting, when you have a lot of advanced equipment for support, you can use ACLS. So ACLS not only uses CPR as support, but also we use medications, we use electricity, we use advanced airway support to help the patients who is in emergency. So when do we shock patients? So we don't just shock patient without checking a rhythm. So I remember when I was watching a lot of the shows, I can tell on the monitor is clearly the patient's flatline. So we call asystole, and then they go in there and shock patient. So when you see in the show, when there is on the monitor is a flat line, we never shock the patient. That means the patient heart has completely stopped. There's no electric activity, so there's no contraction of the heart. So when that happens, we do not usually shock the patient. The electricity will only hurt the patient. So in that kind of situation, we start CPR, which is the chest compressions, and also we give oxygen through patient's airway. And then we give medication such as epinephrine, which is a special medication to help restart the heart. So only when we see on the monitor there is some electricity such as VFib or VTAC, then we can shock the patient. We only shock the patient when there's no pulse. In other situations, when patient has a pulse but has a lethal arrhythmia or patient is not stable, we can also give electric shocks, but we give a lower voltage and we call it cardioversion. In the real emergency, when there is a VFib or VTAC, when we shock the patient, we call it defibrillation, which we use a higher voltage. So next time when you see a show that people just rush in and start shocking patient, you can say, oh, this doesn't sound right. So especially when you see the flat line or asystole on the monitor, that's the time we never shock the patient. So now you know.